All right, it's 9 o'clock. You're now with Newsfeed AM. This is Newzroom Afrika on Channel 405. I'm Ayanda Nyati. As always, such a pleasure being in your company. And true to form, plenty on the go in the news cycle for you this morning. A quick reminder, as always on a Sunday, we're joined by Malan. She's editor-in-chief at the Begisisa Center for Health Journalism. There she is. The Health Hub segment, back again with you this week. And Mia, of course, standing by to help us understand how people's claims of death as a result of vaccination are investigated by medicine regulators. We'll also speak to the health department here in South Africa to try to find out how they are bringing vaccines to the people, so to speak. That and plenty more between now and the rest of the program. But first, as always on a Sunday morning, your headlines, a touch after 9. This is the top story. The family of Nosikele Mtembeni is said to visit the site of her murder today. You'll remember the Fort Hare University student was killed and dismembered, allegedly by her boyfriend in East London this week, sending shockwaves through that community. On the COVID-19 front, the number of fatalities are fast approaching the 80,000 mark in South Africa. More than 260 deaths were logged in the last 24 hours. On the continent, in Zimbabwe, a special audit report has exposed the looting of $890 million in COVID-19 social grants. Plus, Tato Mosehle has now been crowned the second runner-up at the international beauty pageant Miss Supernatural. The 26-year-old is the first person to represent South Africa on that international stage. So welcome to the program. As always, let's get things going on the Health Hub. All right, so in case you missed it, this is the second installment of the Health Hub, and it's done in collaboration with Begisisa Center for Health Journalism. Editor-in-chief Mia Malan is joining us now in our Randburg headquarters studios. And Mia, the Health Hub kicking off things in a big way last week. What can we look forward to today?
So today we're going to hear how the Health Department plans to make vaccinations easier in South Africa. And we're also going to look at a site in Johannesburg where you can drive through to get a vaccination and where it is almost entirely run by volunteers. And as you've mentioned, we're going to hear whether any severe side effects or deaths have been linked to COVID vaccinations in South Africa.
Absolutely. I know Begisisa does a great job at explaining stuff with some graphs, so all of that will be coming up in just a moment. But a lot of excitement in the week gone by because finally adults can now come forward to receive their COVID-19 vaccine, at least those over the age of 18. Let's perhaps begin by trying to understand which jabs are actually available for this population group.
Yes, so the important thing to remember is that we can only use jabs that our medicines regulator, SAHPRA, has approved. So if we look here, we can see that we have a few jabs that have been approved: Pfizer, J&J, AstraZeneca and Sinovac, which is from China. But we are currently only using 2, which is Johnson & Johnson, for which you only need 1 shot. And we're also using Pfizer, for which you need 2 shots. But we've also got 2 other jabs that have been approved, which is AstraZeneca, which was approved much earlier this year, but which we then couldn't use because it didn't work well against the beta variant, which was dominant at the time. And we have got Sinovac here, which has been approved, but it's been approved with conditions. And one of the conditions is that it needs to provide data on how well it works against the Delta variant. And that data SAHPRA has not received up until date. And then there are 2 other vaccines that have applied for approval: Sinopharm from China and also Sputnik from Russia, but no decision has been reached about those 2.
All right, we look forward to finding out exactly what goes into making those kind of decisions. But first, given how many jabs are available, do we know how well they actually work,
So the thing that we really want to know in South Africa is how well a jab works against the Delta variant,
right,
because that's the most common form of the variant, the virus that is being circulated in South Africa. And we also, the most immediate thing that we want from a COVID jab is to keep us out of hospital and to keep us from dying from COVID. So if we look at hospitalization protection here, you can see that Pfizer provides 96% protection against hospitalization and J&J 73%. And then there's AstraZeneca, which provides 92% against hospitalization. And that is why the Health Department is considering it as a third option. It's looking into it so that we have a third option to choose from in South Africa. But Sinovac does not have any published data on how well it works against the Delta variant. And the type of data that SAHPRA is looking for is something that scientists call it clinical data. And that means data test that comes from trials on people or either in a country where they've rolled out Sinovac and there was a Delta variant and they can take real-life data. When it comes to Sinopharm and Sputnik, those are not approved yet, as I've mentioned, but there's no data on how well they work against the Delta variant.
Just very quickly on AstraZeneca, you and I were speaking off air about how South Africa is predominantly actually just dealing with the Delta variant now. It's against that backdrop that AstraZeneca gets back into the fray, even though we had to, in some ways, give it away. I think it was earlier this year, if not late last year.
Yes, the thing about the beta variant and AstraZeneca was that the beta variant has an ability to escape immunity. So it makes vaccines work well. The Delta variant spreads very, very fast, but its immune escape ability is not so good. So AstraZeneca does have data to show us it works against the Delta variant. So for now, with a variant that's dominant here, AstraZeneca would work, but it all depends on what is the new variant that we get in a fourth wave and whether that variant can escape the immunity of some vaccines.
Really chilling that we're speaking about a new variant in the fourth wave. But okay, as we digest that, now that a whole lot more people are coming forward to get vaccinated in some respects, there's been a lot of talks about targets in our country. How are we doing on that front?
So there are many ways to use to look at how we're doing on targets. But today, let's just look at the number of vaccines that we've administered per day. Now, if we look at targets in that regard, we know that the Health Department said that they wanted to reach 250,000 doses per day of vaccinations by the end of August. And we know that President Cyril Ramaphosa had an even higher target at 300,000 doses per day. So let's see, how did we do this week? We can see that Monday to Thursday, on each day, we didn't reach 200,000 doses even. And then on Friday, we were at almost 250,000 doses. And that was, of course, because we opened it up for a younger age group. So what we now need to look at is, why did we not reach these targets? And for a long time, it was because we didn't have enough vaccines in the country. But that's been sorted. We've got more than enough vaccines for the next two months, at least, in South Africa. The issue now is, what will we do to get enough people to sites to get vaccinated?
Absolutely. There has been talks around making it easier for people to receive a COVID-19 vaccine. I imagine that's kind of the strategy that we should be exploring?
Yes, so what we know from evidence is the easier that you make it to get vaccinated, the more people will come for vaccinations. And that has been shown in many countries around the world with COVID vaccinations. So we need to look at ways to make it easy in South Africa. And what we will do is what the Health Department announced on Friday, that we will look at taking vaccinations into communities, and we'll also look at providing transport for people to mass vaccination sites so that we can get more people there faster.
All right, absolutely important details there from Malan as we try to, in some respects, anchor our heads around how on earth we should be moving forward with our inoculation drive. At the onset, remember at the beginning of the vaccination rollout, there had been this kind of perception that a whole lot of people would just rock up to a vaccination site. We've seen part of the strategy from government as they try to inject life into the inoculation plan is to try and open up the different cohorts to come forward. That seems, Mia, like just a short-term answer to a more of a long-term problem. So it's important to try to ask government, if we can, what ways through which we're going to have some kind of sustainable solution to a vaccination drive that's moving fast enough.
Yes, and to hear more about that, let's speak to Dr. Nicholas Crisp, who is the Deputy Director General in the Department of Health, who heads up our vaccination rollout in the country, and he's going to help us explain how the Health Department will make vaccinations easier. Dr. Crisp, thanks very much for joining us this morning. Can you tell us, what are you going to do to take vaccinations to communities? Will you have more pop-up sites and mobile vaccination sites, and how will they work?
Morning, Mia. Morning, Ayanda, and the viewers. Yeah, I think that you're absolutely right. We need to understand where people are and what they do during their days. So if people are going to shopping malls, then we need to make sure that there's a place at a shopping mall, and that's what you're talking about, a pop-up. So it's literally a tent or a gazebo type arrangement where on that particular day, vaccinators will come from the fixed sites and provide vaccinations to people at that site. The same thing can happen at taxi ranks, in people's places of work. Many employers are coming to us and saying, can't you just come to our place of work and vaccinate people at that place of work? So, and then at universities, TVET colleges, other sort of institutions of higher learning that are available, any of them. The idea is that we'll take vaccinators from the fixed vaccination sites as far as is possible and move them from one place to the other so that it's easier and quicker for people to get vaccinated at those places.
So on Friday, the health minister said that you will also try and get transport for people in high-density areas to be transported to mass vaccination sites. And he mentioned an example, for instance, of people in Alexandra who will be transported to a mass vaccination site in Gallagher Estate. How often will this happen and how will they be transported?
Yeah, so this is quite an exciting thing, but it's quite a lot of logistics organization, and it's not the core business of a health department to do it. So we want to be careful. There's a pilot project starting on Tuesday at 5 big sites around the country where there will be shuttle buses. For instance, in the Western Cape, they have a thing called red dot taxis. I think the community there is very familiar with these red dot taxis, which commute people backwards and forwards to various places in the health service. Those red dot taxis in the Western Cape are going to be assisting to get people to the CTICC and down in the city, but also to Athlone Stadium. So 2 big pilot sites there. And then, as you've mentioned, there are a couple of pilot sites in Gauteng. We'll run that shuttle bus and shuttle taxi service together with various operators for a period of about a week to see what we can learn from it, and the pickup points to try and establish exactly where those pickup points are, that people are familiar. And then from whatever we learn from that, we can start to make announcements and roll them out to even more sites.
Dr. Crisp, we know from research that if we increase people's trust in vaccines, they're also more likely to get vaccinated. But for this, we need well-designed communication campaigns. And up until now, we haven't seen enough of this from the health department. So are you planning to improve on this?
Yeah. Thanks, Mia. Yeah, so what we've seen is people learn and get information from a lot of different places. And in the beginning, as we rolled out, it was more formal communication that was taking place on the newspaper, in the newspaper, on the TVs, sometimes radio stations. So now what's happened is a large number of communication mediums have come to us, radio stations, community radio stations, national both radio and TV stations, and have said, we would like to participate. We want to communicate. Can you help us with this messaging so that we are clear that we are communicating facts? So the past week or so has been a very concerted effort to bring everybody on board, provide the material, provide the necessary details of what it is that people are asking us that they want to know. And we should see a lot more in that space. And then on the print media space, a lot of people have asked us, they are prepared to put little notes in with grocery packages, with food parcels and so forth. And can we help them with the messaging? So I'm hoping we're going to see a lot more of this rolling out in the next week or 2.
That was Dr. Nicholas Crisp. He is the Health Department's Deputy Director General in charge of our vaccination rollout. And he was talking about the government's plans to get more people to take up jabs.
I guess on the back of that, Mia, this is a clear, indication, reminder, for lack of a better term, that it really is a multi-stakeholder approach in trying to ensure that we get as many jabs into people's arms. The question I imagine many people watching might still be thinking, though, is, are we not a bit late?
That's a fair question to ask because we're clearly behind on targets, but we can never say too late is too late.
Right.
We must always try and do this. And the 2 things we should really do, you know, in studies, they have 3 C's that they mention. It's complacency. You must make sure that people know they have a risk of COVID. You must make it convenient, so you must make it easy to get vaccinated. And then you should also build confidence in vaccines. And that is what we're really hoping the health department would start to do a bit better, to build trust in vaccines and communicate better around it.
Absolutely. You speak about trust in vaccines. vaccines. We know that a big part of trying to ensure that people actually rock up to vaccination site is around this issue of vaccine hesitancy. So, in just a moment, when we come back, we'll actually try to get you an understanding of how the medicines regulator, that's SAHPRA, investigates your claims if you feel sick and help you track whether or not this is a result of vaccination. Simply put, if someone gets the jab and they fall sick, how does SAHPRA know that it's because of the jab and not anything else? We'll get you details on that and plenty more in just a bit.